welcome to Malini's Health Talk. This is going to be a series of talks about how to improve your health. And we thought we would kickstart this series with a celebrity doctor on board. Yeah, she's become a celebrity because her video has gone viral on YouTube. And there are so many people trying to communicate with her and get her to do the interview with them. But she has very graciously obliged to the interview with us. So who is this doctor? Well, before I introduce her to you, let me talk about her viral video. So what went viral was actually the content where she talks about how you can handle mild COVID symptoms at home without going to the hospital, especially when you have no place, you don't get a place in hospital, you do not get a bed in the hospital. So that's the content that has gone viral, with her garnering more than 100,000 views just overnight, right? And she has graciously agreed to come on board with us. Let's welcome the very beautiful, the very magnanimous, the wonderful doctor on board, Dr. Sandhya Ramanathan. Hello, Dr. Sandhya, and welcome to the show.
Hi, Malini. How are you?
I'm good, thanks. Thanks for joining us today. So I didn't give an introduction to you saying that you've become a celebrity overnight because of the viral video that you have uploaded on YouTube. Did you expect that there will be hundreds and thousands of views and millions of shares of that video of yours?
Look, it's been quite overwhelming. Very humbling, but it's a very important lesson to learn that even one voice can make a difference. And, you know, all I did was provide a plan. You need to prepare for the worst, but hope for the best. So knowing, I mean, we're very lucky in New Zealand. I mean, this, you know, as a doctor, living through a pandemic, which we never expected, you know, 20 years ago when I graduated from med school, in the University of New South Wales in Sydney, Australia. I just never knew that I would be, you know, at the front line of a pandemic. And so we have doctors in particular have been watching very carefully what's been going on. And there's been a tsunami of information coming out. Now that tsunami of information we've had to rapidly assimilate. But in dealing with the assimilation of information, the very important thing we have to be able to do there is then apply that knowledge in such a way that we can protect ourselves, our families, and the patients that we're treating. I'm from India originally. My family's from Delhi and UP. I mean, my husband, Dr. Indran Ramanathan, who's a cardiothoracic surgeon in Auckland, his family's originally from Sri Lanka, but they've been in Malaysia for several generations. And both his parents and my parents migrated to Australia. We're both you know, brought up in Australia, but for the last 12 years have been living in New Zealand, and we've got 2 children. And so I've, you know, this whole time I've been looking through the information, and I've been quite active on social media, trying to decode the information and make it relevant for the layperson, because doctors as it is are going to share the information, but there's no value of that information unless that information gets filtered down to the layperson. And I was looking for solutions which were cheap, cost effective, and would go a long way in providing reassurance. Because remember, yes, you can manage at home if you follow these steps. And hopefully by following these steps, you will prevent the infection. You will do everything in your power to prevent the infection from becoming severe and requiring hospitalization. But none of the stuff that I went through in the video is meant to negate getting your own medical advice. It's just general practical tips, which I pretty much put together for my own family to try and protect them. And it was basically what I would do if I was in that situation.
Okay, so you did say there's a tsunami of information. And for the lay person, what is COVID-19?
Coronavirus is a virus. It's just one of the viruses from a group of virus. So this particular one is called SARS-CoV-2, and this originated and was first found in Wuhan in China, I think in November 2019. And a very important knowledge for everybody to have is that its point of weakness is its fatty envelope. To disrupt that fatty envelope, you need to use frequent hand washing for 20 seconds. So, you know, this is crucial for people to understand. Otherwise, they just don't do it. Like, you know, if you had a child, for example, who was saying, look, I don't want to wash my hands, you could just, you know, make them understand by, say, getting an apple, putting a thin film of oil over the apple and saying, okay, if you think, tell me, just try washing that off with just water or in under 20 seconds. And they won't be able to remove it. So the same way, if you can imagine that all the particles of coronavirus that you might have touched, which are invisible, minuscule layers of tiny little oily things. And so if you wash thoroughly your hands properly for 20 seconds and dry carefully, then you're going to kill anything, and especially before you touch your mouth or your nose or your eyes. And so the other thing to understand is that coronavirus is transmitted from person to person, and it's via their respiratory droplet. So obviously, talking, especially talking loud, sneezing, coughing. So the other very important practice is sneezing or coughing into your elbow, not going out if you're sick. But if you are out, maintaining a social distance. If you can't maintain a social distance, it's very important that you wear a mask. And I just want to demonstrate, because this is also a very important thing, because the mask is very key. Because even if you live in a city where there's a lot of coronavirus, the mask goes a long way in protecting you. You basically have to assume, because up to 80% of people can be asymptomatic, that everybody has it. So when you interact, you don't know how infective, or if that person's going to basically turn up with symptoms tomorrow. So if you're wearing a mask, and you just need a cloth mask that covers your nose and your mouth. Okay, I'm just going to put it on. Ideally, your hair should be tied back if you're a female. It shouldn't be out. And, your hands should be free. So your mask should cover. When you put on your mask, your hands should be clean. Okay? When you're out, you shouldn't be fiddling with the mask at all. Okay? You shouldn't be moving it to talk on your phone. You shouldn't be doing anything. If you cough or sneeze, the mask should be on. Then, when you go to take it off, you have to assume that the outside of the mask has coronavirus on it. So you have to clean your hands carefully, and you have to remove it from the ears and pull it away from your face. Another layer of protection you can add is wearing glasses. This will pass. We will get through this. But rather than thinking that, oh my God, this is awful, and this is, and feel fearful all the time, there was an Australian doctor who said it really well. And he said, social distancing is an act of love. It's not an act of fear, because you are sort of saying, I don't want to infect you.
But what are the signs and symptoms? How do I manifest that virus?
It can be any symptoms that you've normally had in terms of having a cold. But significantly, they talk about fever, cough, and tiredness, sore throat, runny nose, headaches, you can have muscle aches and pains, you can have diarrhea, you can have stomach pains, shortness of breath is a worrying one, so is confusion. Some people also manifest skin signs, and in some severe cases, people can also have signs that are like they're having a stroke. Or the other very interesting symptom is loss of sense of smell and loss of taste, and that's quite an unusual symptom. And interestingly, in the early days, when they were trying to track how long that coronavirus had been around, they were actually doing Google searches to find how many people were searching loss of smell, to try and get an idea of how many people may have had it. So that's quite interesting.
When I do manifest the signs and symptoms of COVID, what do I do? Do I have to go to the hospital immediately? Do I get it tested? And you said it's good to get tested. What if I do not have, like in India, if you look at it, we have had cases where they were not able to even get access into the hospital to get a test done. So what do I do then?
So don't rush anywhere out before calling in advance, okay? Because the last thing you want to do is, when you think you have COVID, but you may not, is go wait in a long queue with a whole lot of other people who think they have COVID and possibly do have COVID, and catch COVID from them. So the ideal is that you get tested, but you get tested safely. If you get some health advice, even if it's virtual, then it's good. I mean, only 1 in 5 of the cases actually need to go to hospital or need any hospital level care. And generally that's not going to be straight away. So if you're a fit and healthy person, you're probably going to be fine. Of course, it's another situation if it's somebody who is, elderly, if they've got multiple medical underlying conditions, then obviously that's going to be a different situation, and you'll have to be in close consultation with your doctor.
If you look at the New Zealand case, a lot of people who had signs and symptoms were told to be isolated and stay at home. We did not overwhelm our medical facility. There were very few of them who were actually admitted in hospital, but most of them who had the mild signs and symptoms were told to isolate themselves. So how do I take care of myself when I show signs and symptoms of mild COVID infection?
One of my key recommendations is that everybody have access to a device called a pulse oximeter, okay, which looks like this. This is a very easily available and affordable medical device, and it is also inbuilt in some models of phones. In India, I think it's the Samsung flagship phone, has an S series, and there may be other phones. I know the iPhone doesn't have one, but if you have one, this is really good. The reason is that in a lot of the bad stories we heard about, people suddenly declining, and suddenly they were going okay, and then you heard around probably the day 10, 12 mark, suddenly everything went downhill. Often this was due to something called what they dubbed happy hypoxia. And so when the patients came in, they were still like talking on their phone, and the doctor was shocked to see that their saturations were so low, inconsistent with, being able to sit and talk. And that's because the pathology that causes the lung damage is quite different from other infections. It's through microclotting. If you are at home and feeling well, and your oxygen saturation is staying between 95 and 100, which is normal, then you can be pretty happy that, I'm okay. I don't have this silent hypoxia. I'm not about to keel over. But if your oxygen saturation is dropping, below 93, and you're not picking it up with doing the exercises that I can go through with you, then and especially if that's associated with difficulty breathing, shortness of breath, then you need to get urgent medical advice. So I'll just quickly show you how to use this, because, it's not enough to just get it. You need to know how to use it and use it properly. So you just turn it on. It comes, you just put in some batteries. And what this does is it basically measures the oxygen saturation in your blood by shining a light just into the pulp of your finger. So you just insert your finger into it. Okay, so you can see there's a light there. So your finger has to go all the way so that the pulp of your finger is on that light. You have to do it properly, otherwise your saturation won't read properly. And then it'll do a reading, and it's got a pulse and it's got a saturation. So I'm saturating at 99. Okay, so 99%. So that's pretty good. Okay, so the normal rate is between 95 and 100. It's a common medical device. It's easily available. It's, relatively affordable. And just, one amongst your, group of family, extended family, one's enough. This is the most expensive thing out of my whole plan of what I've recommended, and this can save lives. So the management plan I went through in the video was a 3-step management plan. First and foremost, it's priming and boosting your immunity. Number 2, it was reducing viral load. And number 3, it was breathing exercise and positioning. Your first point of defense for any infection is your immune system. So that's something that you need to start working on now and making sure that it's in peak condition, so for when you do get sick. And in terms of your immunity, there's 5 very important factors, and that is you need to eat well. That means eat real food that's not processed food, colorful vegetables and fruit, and whole grains, and minimize any alcohol or sugary drinks or any junk, namkeens, processed foods, etc. You need to sleep well. Sleep is crucial. You need 7 to 9 hours of good sleep a night for a good immunity. You need to move more. You need to do exercise. Something like yoga is fantastic, but some cardiovascular exercise, even if you're in lockdown, you need to do some exercise. You need to love more. And by loving more, I mean you need to remain connected with your loved ones, because loneliness is very bad for your immunity. And we're lucky that this has happened in an age where technology has allowed us to remain just as, if not more, connected with people. The sum total of these 4 things will mean that you will stress less. That's your base immunity. when you get infected, at the first sign of infection, you need to add in 3 immune boosting supplements, compulsory. And these have pretty good evidence behind them. One is vitamin D. And I would say vitamin D replacement for Indians should be compulsory anyway, because Indian skin takes longer to absorb sunlight and get an adequate vitamin D, and they're often low in vitamin D anyway. And the studies have shown that the people who were low in vitamin D had poorer outcomes with COVID. So it's very important. In fact, in the UK, they came out saying that all adults should be having 400 international units of vitamin D a day. You can even give vitamin D to children, but obviously just check with your health professional, or there are a lot of charts available online, but I would start taking vitamin D supplements straight away. You must be taking zinc, and it has been used in treatment regimens for COVID across the world. And the other one is vitamin C. Just take some. Some is better than none. And just take, whatever standardized dose there is. But definitely you need to take these 3. So you've got your immune system, which I told you to keep it primed, but those 3 things need to keep it boosted. You can add other things like turmeric, echinacea, Ayurvedic things, whatever you want, but those 3 things are compulsory. The second thing, which I talked about, was viral load. What the nature of this illness is that it enters through your nose and your mouth and starts replicating in your upper respiratory tract. So you need to try, if your immune system manages to fight it in the upper respiratory tract, hopefully it won't go down to your chest where it really causes havoc. So first you've primed your immune system and you're really working on that to make sure it's fighting the infection as much as possible. You're taking adequate rest because you're sick. But on top of that, you need to do nasal rinsing and gargling to try and physically dislodge and dilute that load. Like a saline nasal spray, which you can spray up as much as you want. I actually talked about nasal rinsing, where you can get these squeezy nasal rinsing bottles. They come with sachets, but you can make up your own just using half a teaspoon of salt and half a teaspoon of bicarb soda in it. And then if you wish, you could put a few drops of betadine gargle concentrate in it. And that looks like this, the betadine sore throat gargle concentrate, because again, it's just an antiseptic. And you can basically do a nasal rinsing where you lean over a sink and you direct the flow of the rinser back towards your throat, and it will come out through the other nostril and through your mouth. And in addition to the nasal rinsing, of course, it's gargling twice a day with warm salty water, or even better, making up the betadine throat rinse, or it comes in a ready diluted betadine gargle as well. Or if you find that too irritating, you could also use a antiseptic mouthwash, like a Savicol mouthwash. But basically something is better than nothing. The other thing which is helpful is steam inhalation. Obviously, if you've got a congested nose and if you've got loss of sense of smell, it can also help with trying to get that back. Put a little bit of Vicks in some, and pour some boiling water, and then just put a towel over your head and take that steam twice a day. And the other very important thing is nasal decongestants. So something like an Otriven sort of nasal spray. I think they come in different brands in India, and they are designed to dry up your nasal discharge, because not only does your nose run forward, it runs back and causes a tickle in the back of your throat. And post-nasal drip is one of the most common causes of cough. So if you can basically dry up your nose, you can go a long way in trying to prevent it going down into your chest. So this whole upper respiratory tract, doing all of this stuff, multiple times a day is extremely important. So what the point I was trying to get at, it is an active management plan. It's not passive. It's not that usual, oh, I'm sick, I'm just going to go lie down and wait for this to go away. Yes, rest is important. But in this infection, I truly believe if you throw your everything at it and you fight, then you will give yourself a better chance of making a full recovery. The third thing was the breathing, which now will relate back to the saturation. Okay, so the first and foremost thing is that before your saturations drop, you want to be doing these breathing exercises every day while you're sick. So basically, in my video, I use this analogy of this sponge. Okay, so this is just a sponge, which, if you imagine it more shaped like this, is the same sort of theory as our lungs. Okay, our lungs are filled with little air spaces. And most of them, the biggest concentration, because obviously you're smaller here and you're bigger here, is at the bottom. And most of the lung is actually located at your back. When the doctor goes to examine you and they want to listen to your chest, listen to your lungs, they hear from the back, because you know, and anatomically, most of it sits at the back. You have to understand that in the breathing mechanism, breathing out is the most important one to concentrate on. You know, often people concentrate on taking a big breath in. Actually, you need to focus on emptying your lungs as much as possible. So I want you to imagine that the oxygen that we want to take in from the atmosphere is water that wants to soak up into this sponge. Now, if I wanted to soak up the maximum amount of water in this sponge, first I'm going to have to wring it totally clean before I can then refill it. And see how even with the sponge, the refilling is reflex. Okay, once it's emptied, it's going to reflexly open. So the same way, once you've actively focused on breathing out all the way, inhalation is a reflex. Deep inhalation will be a reflex. Okay, so I'm just going to do this and breathe out and show you with the sponge. I'm going to hold it there. And I'm going to hold it there before taking another breath. Okay. Now, I told people about something called box breathing, which is something that's very good for reducing your stress level and something to practice now when you're well. And basically, that's when you imagine that you're drawing a box while you're breathing. So the same, you start breathing out and you count, to 3 seconds breathing out and then 3 seconds breathing in. So basically, one breath cycle is 6 seconds, 10 breaths a minute. As you get better at it, you can extend it and make it even longer, 5 seconds each cycle. Right. So I'm just going to do 3, and you do breathe out 1, 2, 3, okay? Hold, draw the line up. 1, 2, 3, hold, draw the line down. Okay, so that's box breathing. So that just having that visual box while you're breathing helps slow down your breathing. And basically all the symptoms of anxiety, that impending doom, panic attacks, that is all caused by the gas balance change when you hyperventilate and, the carbon dioxide levels go up. So the best control of anxiety is slow breathing. Now, when you're sick, it's very important that you do breathing exercises to make sure that your lungs are staying open as much as possible. So what we want to do is make sure that these little air spaces at the base are not collapsing down. So when I was discussing the importance of, breathing out with one of my classmates, Dr. Anne-Marie Bosco, who's a hematologist in Sydney, her mother is an anaesthetist in Malaysia, and she told me that her mum recommends to patients to blow balloons as a form of creating, simulating what a ventilator does to the lungs, but in a very simple way, you're doing it to yourself. And this was a very beautiful and I thought affordable way to show people to be able to do an exercise to make sure that, you're giving your lungs the best emptying possible. Okay, so I'm just going to demonstrate what I want you to do. I want you to get a balloon that's powder free. And I want you to try and blow it up over the course of, say, 3 breaths, focusing on a long exhalation each time. Okay, so here we go. And I'm inhaling well between each one. Like I would say, try and do it for 5 minutes. Seated. Please do these exercises seated. We don't want you, fainting. Okay, so I'm just going to check my oxygen saturation. Yeah, and now it's 100. Yeah. In fact, I treated somebody with COVID, and he was an ex-heavy smoker, had a history of pulmonary TB, and was living in a polluted city. And while being sick, he managed to get SATs of 100 just by doing the balloon exercise. If you've got family members who are unable to blow a balloon, then you can just get them to simulate blowing a balloon, like they can do an imaginary balloon, so like a and then breathe in. Or you can do other pranayama. Another very much gentler way is using your straw. Get a glass of water and blowing bubbles into that glass of water with the straw is another way to gently create resistance and incentivize, breathing out. So you'll be doing this. And I would be doing that several times a day, seated, obviously, and rechecking your saturations. The other very, very important thing is your positioning. And her lungs are mainly situated at the back, okay? Now, if she's sick and she was to lie on her back, what's going to happen is that those lungs are going to get compressed, okay? And they're more likely to collapse, okay, because she's sick. It's okay when you're well. So what they're finding that, and that's what's happening, is they're doing this thing called prone positioning, where they're putting their patients on their front. Now, I just wanted to use this cushion because people have a problem thinking about it. If you were to lie on your front with the pillow under your neck like this, it'll be very uncomfortable. But I would say turn the pillow so it's under your whole, you know, chest and head, and sleep with your head to the side. Poor Rani can't move her neck, but she's sleeping on the front. And it's clearly, you can clearly see now when she breathes, the full of the back will expand. Even if she sleeps on her side, the side lung is going to get compressed. Okay, so when you're unwell, you must, with COVID, you must not sleep for a prolonged period of time on your back. Okay, so you need to, and that's why yoga poses are good. Something like the child's pose and doing breathing exercises in that pose will be very good as well. And this is very important. In fact, I had another case of a lady who, you know, they were trying to get a hospital bed, and she was in her 70s. Her SATs were 93. The family was getting really worried, but they couldn't get a hospital bed. But all night they monitored her saturation while she slept on her tummy, and her saturation came up. Okay, so, you know, it can make a huge difference, and this is a very important thing. So that's basically a summary of all three things that I was talking about in terms of active management. It was immune priming and boosting. Then it was reduction in viral load by the nasal and, you know, throat rinsing. And third, it was the breathing exercises and positioning. And and throughout that, it's using the oxygen saturation monitor every day, at least for the first 14 days of the illness, and making sure that it's staying between 95 and 100 preferably, and definitely not dropping to, I mean, if it was dropping, then obviously you would need medical advice. And then you can be pretty happy that you're safe. The other thing is, it's very important right on to get, as soon as you're sick, the reason it's important to get medical advice is because a lot of countries have a very simple regime for antibiotics, which are most effective if they're taken early. So there's no point calling the doctor 10 days into the illness, because again, it's an imperfect science and it's an evolving science, but there are simple antibiotics, you know, such as hydroxychloroquine and azithromycin and doxycycline and various antibiotics which are showing promise, are helping, are being used widely, needs to be prescribed by a doctor and needs to be done early. But again, that could be done virtually, and you could pick it up from the pharmacy. You could take it, you could self-isolate, and you know, you're probably okay. You probably don't need to go to hospital.
Thank you so much, Dr. Sandhya. So that was a comprehensive plan that you have laid out for people who are going to be at home and they're thinking what they should do. So you had gone through how you prime your immunity, and then you had gone on to telling us about how to reduce your viral load. And these are things that you have available in your homes, or it's easily available. So other than the oximeter, the rest of it is something that's widely available and is not so pricey. So I think a lot of people will benefit from this. Once again, thank you so much, Dr. Sandhya, for joining us on this program. And I think it was awesome that what you are actually doing is reaching out to so many people and also trying to save lives. And it's something that you can do at home, and you can manage COVID-19. And as you said, you were very promising, you were very hopeful when you started out, and that's how it's going to end. So this too shall pass. And thank you once again, Dr. Sandhya.
Thank you so much. Thank you so much for having me. And everybody, stay healthy, stay safe, and stay positive.